the most deadly and the awaited one, and that is hepatitis B. So let me tell you a little bit about genotype, serotype, and then I'll start with pathogenesis, structure and everything. Guys, over here please remember there are 8 genotypes starting from A to H, whereas D genotype is the one that is prevalent in India. Question number 1. Which genotype is prevalent in India for hepatitis B? It is genotype D. Then there must be some serotypes also. Yes, you don't have to learn all. Neither do you have to learn north and south, east and west, but at least learn the names. AYW and ADR. These are the serotypes which you are finding in India. Repeating, AYW and ADR are the serotypes in India. D genotype is the one that is prevalent in India. Now we can go on to, let me take a quick test. Which family was this? This was Hepadnaviridae. So this means this was the only virus which was DNA, the only and only hepatitis virus which was a DNA virus, and my logic tells me that all DNA viruses are what? Single stranded or double stranded? All the DNA viruses are double stranded, but यहाँ पर एक catch है. Yes, this is a double stranded DNA virus. Correct, but there is a catch over here that it is a partial double-stranded DNA virus. So, pehle to you will say, ma'am, what is the double strand? Double strand means there is a minus strand and a plus strand. Plus strand can make the proteins forward, minus strand cannot. So there are 2 strands. Double stranded to hai. I can see over here very well that there is another strand and 2 strands. I can see na. But can you see one of them is totally complete, pura aisa round. The other one, it looks as if it is a part is missing over here, incomplete, exactly. So the minus strand is complete, the plus strand is incomplete. You don't know which is complete or incomplete, you don't have to know, you just have to know one of them is complete and one of them is incomplete. So is it correct to call it just a double-stranded DNA? No, ma'am, thoda sa part missing hai. This is a partial double-stranded DNA. So now I want to make a table for all of you because you have already done this in general virology. All the DNA viruses are double-stranded DNA viruses. However, there was one exception जो पूरा ही single-stranded था. Which is the single-stranded DNA virus? Remember, Paro was left alone, so parvovirus was single-stranded. And which is the one that is going to be partially double-stranded? Now you know that hepatitis B is partially double-stranded. It has a chota sa missing strand. Now, we have done the andar ka DNA, but what about all the other things that are around it? So let me first tell you the names of it. It has certain genes. One is said to be the P gene, the C gene, the S gene and the X gene, and these will make the respective proteins which I'll keep labeling. So सबसे पहले P gene मतलब polymerase, and P is the largest of them all. So what did I say? This is the largest of them all, and P is gonna stand not. So they ask you कि P gene से क्या क्या बनेगा? DNA polymerase होगा. Also you have reverse transcriptase. You'll say why? Ma'am, reverse transcriptase activity is needed in RNA viruses. This is hepatitis B, DNA virus. Why in a DNA virus do you have a reverse transcriptase? Give me 5 minutes. You will realize this is very important. Apart from that, also RNAs. So remember the P gene, which everyone takes very lightly, it makes polymerase. No, it makes 3 things. This is a question that can come. The P gene makes 3 things. DNA polymerase understood, P for P, but it makes 2 R's also, the reverse transcriptase and the RNAs. Okay, so this dot over here was the P gene ka products, polymerase, RNAs, RT, all that. Now coming to C. C is what? C is said to be the core gene. It's said to be the core gene, and if you actually look at the structure of this core gene, you will realize not only does it have a core area, it also has a pre-core area. Not only a core area but also a pre-core area. That means the core area is going to code for the C antigen and the pre-core area is going to code for the E antigen. There are 2 antigens coming out of it. The core area is going to be the C and the pre-core area is going to be E. Finally, coming to S. S stands for surface antigen. S is going to stand for surface antigen. Let me show you an enlarged version of it, otherwise it won't make sense. Can you see these things which are coming out? That is of course going to be the surface antigen. How do I write it? I write it as HBsAg. However, I see that these surface antigens have different shapes or sizes, I can say, small, medium, large. If you look at these, they will have different sizes. They are small, medium and large, exactly. So please remember the surface antigen which you write as HBsAg, they can further be of small, medium and large variety. Finally, coming to HBx, remember HBx is the one that is responsible for carcinogenesis. Many people ask me that how does hepatitis, which cancer? Hepatitis, liver, of course. How does hepatitis cause hepatocellular carcinoma? It is going to be HBx. The reason for it is HBx. So jaldi se let's do a recap. What are the genes that it has? Sabse easy wala I can see on the surface. Let us do a recap from here. On the surface you have the S gene. That is going to make surface antigen small, medium, large. Then you have a core. You have a core antigen, and core antigen actually makes two things. It makes core also, it makes pre-core also. After that you have the DNA polymerase, but again it not only makes polymerase, it makes two R's also, reverse transcriptase and RNase. And finally you have an X protein that is hiding, and that X protein is responsible for something deadly, and that is cancer. ठीक है, यहाँ तक हो गया. Now my next question to you is, which out of all of these can I call as Australia antigen? So please note that this surface antigen over here has been given another name called as Australia antigen. This has been called as Australia antigen. So these two words become very, very important. The surface antigen is known as Australia antigen, and the next thing that they will ask you is what is Dane particle. So ये पूरा जो virus है, this full virus that I have taught you right now, this entire virus is known as, or hepatitis B virus, complete virus, no part missing, that is known as the Dane particle. Do not get confused between these terms, because now I'll tell you, if you feel that when someone gets infected with hepatitis B, this is all that is circulating in his blood. No, this is the complete wala form circulating in his blood. Do you know little bit parts of this are also circulating in the blood? So let me now teach you that yes, the complete Dane particle, what was the size of hepatitis B? 42 nanometers. So the complete or the full virus, the Dane particle means, ma'am, it has the genome also, the double-stranded DNA, everything that it has, pura infectious wala, yes, that is roaming around, but that is 42 nanometers. Uska kuch chota version is also roaming around. Some 22 nanometer things are also roaming around, which are known as spheres and filaments. They are parts of this. Basically what happens, I told you na, that this surface antigen can be made up of small, medium, large. So when I say that some small and medium wala strains are roaming around, I'll say they are like babies of this. Some babies are also roaming around. Babies are never going to be infectious. So please note that ये जो spheres and filaments होते हैं, which are almost half the size, 22 nanometers, since they don't have the genome, they are not going to cause the infection. So who is capable of causing infection? The full virus is capable of causing the infection. That is the Dane particle. Repeating, the Dane particle is capable of causing infection, and the size of it is 42 nanometers. Although you don't have to write it, but just listen it out once, that if I take the blood sample from a patient and I try to see na zyada kya hai, do these patients have more of full particles or do they have more of these chota parts? Babies are more. Trust me, these are more. These non-infectious things will be seen roaming around more, and the full particles are going to be much lesser. Finally, coming to mode of infection and pathogenesis, I think everyone knows parenteral, sexual, mother to child. I don't have to teach you that. Parenteral means blood products, of course, needle sticks, IV drug abusers, all of that also comes. Sexual intercourse, mother to child also. Percutaneous route is also known, and for us healthcare professionals, needle stick injury. Now, because we are studying it, to pura pad lo. Please note, when I'm talking about needle stick injury, I have learned it as blood stick injury. Okay, just for my mnemonic. What is blood stick injury? Because blood stick injury mein B is for hepatitis B, C is going to be for hepatitis C, and I is HIV. So I have written it as blood stick injury, BCI, because of hepatitis B transmission chances 30%, hepatitis C transmission chances 3%, and HIV transmission is 0.3%. Come, 110 you will keep on removing. That is why first you need to know the order. For needle stick injury, I have learned it as blood stick injury. 30%, 3%, 0.3%. Very famous question. I will also tell you the protocol after this for what happens after a needle stick injury. What are you supposed to do? So once this mode of infection has occurred, what is the pathogenesis going to be? That is very interesting. This is one of the most interesting and not so student friendly pathogenesis. We'll try to simplify it. The books have made it super complicated. complicated. We'll try to make it a little easier. Tell me something. This is a HBV, hepatitis B. So the first thing that you are going to say out to me over here is going to be that this is going to come inside. How is it going to come inside? It is going to come inside by a process known as, yes, endocytosis. So all of you can see that this has been engulfed, right? So basically it has entered the cell. Step number 1 is going to be entry. After entry, you say, I am not interested in all those layers. Remove them. Uncoating karo. I am interested in this DNA. Tell me, what kind of a DNA does it have? Does it have double-stranded? Yes, it does have a double-stranded DNA. But is it a complete double-stranded? No, it is a partial double-stranded. See, a part of it is broken also. Either dekho, a part of it is broken and a part of it is complete. The partial double-stranded DNA is there. My first thing is, whatever was left incomplete, please complete it. So the first thing that we make is cccDNA. What is cccDNA? Usse pura close karo. Please complete it. Covalently closed circular DNA. cccDNA is covalently closed circular DNA. If you don't want to learn it, at least learn that the incomplete portion is first completed. Pehle to complete DNA banao. From that, of course, you know, from DNA, guys, if translation occurs, what are you going to have? You will have the formation of RNA. What is that RNA known as? pgRNA. So you have made pre-genomic RNA. You have made RNA. You'll say, fine, ma'am, now from RNA, you have to make new viruses. So I'll say, okay, wait, hepatitis is a DNA virus. And now what you have at this point of time is, from this covalently closed circular DNA, ab to yaad hi ho gaya na, covalently closed circular DNA, you have made a pgRNA, and what have you done? You have made a nucleocapsid also around it. What a funny thing. This was a DNA virus. You made a mistake. You were supposed to make a DNA. You have enclosed an RNA by mistake. This is not a mistake. This is the pathogenesis. That is the question that you asked. That initially what happens is that the capsid is made around what? The capsid is made around pre-genomic RNA. So you will say, aise to nahi chalega. This is not an RNA virus. Please change it into DNA. How do you change an RNA to DNA? If I have to change an RNA into DNA, what enzyme will I use? I will use reverse transcriptase, and that's the catch. Remember, I told you something called a P gene, and I kept on saying that everyone says, "Arey, P gene is DNA polymerase, but it will also have reverse transcriptase activity." And you were wondering, where will I use reverse transcriptase? Here it is. Yahan pe thoda sa galti hua. There's a mistake. By mistake, you ended up enclosing an RNA. First, you'll have to change it into a DNA. You know how do you change it into a DNA? By a reverse transcriptase. But this DNA is which strand? Ma'am, there were two strands, minus wala, plus wala. So the first thing that is formed is a minus strand DNA is formed. Okay. Now after minus strand DNA, you will have to make a plus strand DNA. So you will have to make the second one, jo plus strand wala, jo second wala hai, that is made how? That is made by DNA polymerase. Now you know how all those enzymes are being utilized. So nice. So repeating, you ended up enclosing an RNA. So then you said, never mind, once a mistake is done, I will rectify it. I will first make a minus strand DNA with the help of reverse transcriptase. Then I will make a P for P. I will make a plus strand DNA with the help of DNA polymerase, and finally itna kuch banaya, I need to assemble it and make it one virus, and that is going to happen in the endoplasmic reticulum. So I'm going to make one whole virus, and finally I am going to release it out. That is how this is different. Everything. What are the key factors that they'll ask you? Sabse pehle, what is the DNA? Partial. So I will have to close it. Covalently closed circular DNA. Then I make what RNA? I make pgRNA. By mistake, I enclose it in a capsule. Then I rectify my mistake. I make a minus strand of DNA with reverse transcriptase, plus strand of DNA with DNA polymerase. Sab kuch ek saath jodo in the endoplasmic reticulum and release it out. I hope everyone's okay with this set of information. Very important pathogenesis that they are going to ask you. Now that you've done this pathogenesis, I'm going to take you to the most important, and that is lab diagnosis. I know this graph is something which is very, very scary for you. I will tell you every part of it. Then I will make a final table and a mnemonic of how to learn it. So, sabse, if pehle I ask you, look at this and read this question carefully. The first virological marker that comes out in the blood, and everyone jumps to the answer of hepatitis B surface antigen, because that is what I saw, ma'am. But no, I did not ask you the first antigen to come in the blood. I asked you what is the first marker to come in the blood, and that is the DNA. If HBV DNA is there in the option and they ask you which is the first marker to come in the blood, HBV DNA, of course. But if they ask you the first antigen to come into the blood, yes, I can see that it is the hepatitis B surface antigen, and I need to correlate that with the help of symptoms. I can see symptoms matlab why jaundice, na, yellowish jaundice. So remember, it appears 2 to 6 weeks before the onset of symptoms. That is why it's the first antigen to be there, and you can very well see 1 to 2 months after the onset of jaundice. So agar yahan pe dekhen, this is somewhere coming around the 4th week, and symptoms are somewhere coming around the 10th week, if I can say so. So is wale case mein, so somewhere between 2 to 6 weeks before the onset of the symptoms, it's gonna come up, and 1 to 2 months after the symptoms, it's gonna stay. So I realize if I start tracing hepatitis B surface antigen and the symptoms are over, it is still there, you'll say, ma'am, once the antigen is gone, the antibody should come, hai na? Bilkul, the antibody comes next. But when the antibody comes, this is anti-HBs antibody, bilkul. If this is present, this means I will say this is an epidemiological marker. I will say the person is in a stage of recovery. However, do you see there is a gap between the ending of the antigen and between the starting of the antibody? There is a gap. Imagine if my patient would have come in this stage and I would have done a blood test, neither would have the antigen come positive nor would have the antibody come positive, and then I would have told the patient that you are to hepatitis negative. Is a window created over here? Yes, antigen has gone off and antibody is coming after some time. So there's a gap, a window created. How will I test? How will I find out if someone is positive in this window? This is window period. I will tell you in a while how we do that. But abhi ke liye, what are the 3 points? Hepatitis B is the first to appear. So if I ask you, who tells you the onset of infectivity? Which antigen tells you the onset of infectivity? Hepatitis B surface antigen. 2 to 6 weeks before jaundice till 2 months after jaundice. When it will end, a gap hoga, then the antibody will come. Okay. After this, if you look, hepatitis surface is done. Shortly after it, hepatitis E is coming out. What was hepatitis E, if you remember? Pre-core antigen. So I can see na hepatitis surface yahan tha. Shortly after it, I can see that HBE is also coming up. So it appears shortly after HBS. What does it indicate? HBE tells you, oh my god, infection. It tells you the load. Basically, it tells you the infectivity rate. So not everyone will be HBE positive. If HBE comes out to be, antigen comes out to be positive, that basically means that the patient has high infectivity. And this means that once this antigen will go off and its antibody will start off, you will say, oh, this means now the infectivity is going down. When I say that the antibody has come, that will mean that the infectivity has gone down. Samajh aa gaya? So till the time the antigen is there, highly infective patient, once the antibodies will come out, this means the infectivity has gone down. So kya antigen ho gaya? The first one was surface to come. S comes first. After that, E comes. What are you expecting next? Ma'am, ab bacha kya? S done, E done. C is the next one. So where is the core? Tell me something. The name of HBC antigen, which is core antigen, don't you feel it is stuck in the core? The virus का जो core है, this C antigen is stuck in the core. Will it be able to come out? No. Remember, this is the only antigen which is not detected in blood. That is the catch. This is not detected. See, it's there in your body. It has entered into your liver cells, but it is not going to be present in the blood because it's stuck in the core. See, antigen though did not come out into the blood. But are you exposed to it? Are you going to make antibodies? Of course. Anti-HBC antibodies though I will make because it's sitting in my body, so I have to respond to it. Which antibodies do I have? IgM and IgG. So let me start tracing it. I see over here, look at the red wala line. I can see the red wala line and how this IgM anti-HBC is covering a very essential part of my life. If you remember, I was telling you one problem that, patients may surface antigen goes away and antibody comes very late. There is a gap present. There is a window period present. Who is still covering that window period? Is this antibody. Who is the marker of the window period? The IgM anti-HBC antibody. IgM type of anti-HBC antibody is doing that work for me. It is covering the window period that I had. So over here, I had no one to help me. Now I have someone. After this, of course, IgM के बाद of course what is going to be there is going to be IgG, so that's the next antibody in the long term. But remember IgM as a marker of window period is very very important. ठीक है, now you have, what all have you done? If I give you a very quick brief, first was surface antigen, then along with it HBe antigen can come, then there can be anti-IgM type of anti-HBC. Then of course later on you are going to have the anti-HBe and the HBS and SARA antibodies will come. So now if I ask you an answer to all of these questions, let's see if you can do this. Tell me, what will you say is acute hepatitis B? What all is going to be acute hepatitis B? So you will say, ma'am, everyone, first thing to rise, if you're saying hepatitis, the first thing to rise has to be HBS, definitely. After that, acute बोल रहे हो तो अभी obviously the antibody has not come. HBS के बाद कौन आता है? S के बाद E आता है, तो of course ma'am HBe antigen has to be there. Then the IgM antibody comes, IgM anti-HBC, and that is what known as acute hepatitis. What is SEMA? SEMA tells me that in cases of acute hepatitis, you have SEMA. SEMA मतलब SEMA, surface antigen होगा, HBe antigen होगा, and which antibody? IgM type of anti-HBC will be present. That is what you will call acute hepatitis. This acute hepatitis is low infectivity or high infectivity. Who tells you infectivity? Hepatitis E antigen tells you infectivity. If hepatitis E antigen is there, this means it is high infectivity. Okay, then what is chronic hepatitis B with high infectivity? You will say, ma'am, again hepatitis है तो S तो होगा, high infectivity है तो E भी होगा, but this time you are saying chronic. If you are saying chronic, I will change this IgM into IgG. So what is the profile? What is the profile gonna be now? So I will say surface, yes it's there. High infectivity hai E, yes it's there. But because it's chronic hepatitis, instead of IgM, I will write IgG type of anti-HBC. Is life becoming a little simpler? SEMA yaad kar liya for acute hepatitis. Chronic ke liye just change the M into a G and that becomes chronic hepatitis. In any of these, if I don't keep E in it, it will become low infectivity. You know that. Finally, let's talk about recovery. If a person is recovering, recovery का क्या definition होता है? Antibody, antibody, antibody. If a person is in recovery phase, that means anti-HBS, anti-HBC, anti-HBE. Recovery matlab all the antibodies are gonna be there. Next, what is the window period? Ma'am, window period was the time when no one was helping you. Window period was the time when no one was helping you except one person. What is the marker of the window period? The marker of the window period is IgM type of anti-HB, anti-HBC. Okay? Finally, immunity. If someone has been given a vaccine, because the vaccine is to do with surface antigen, where vaccine का जो preparation होता है, that is surface antigen, so the antibodies formed are always anti-HBS. So if a person has been vaccinated, it is only anti-HBS that the person is gonna show. So I'll do a very quick recap. SEMA हुआ तो acute hepatitis with high infectivity, M replaced by G, so that means that is chronic hepatitis. Recovery matlab all antibodies, immunity matlab only anti-HBS, and window period is anti-HBC of the IgM type. However, we're forgetting one thing. What if hepatitis B infection happens in a pregnant lady? How are you going to deal with that? And what vaccine are you talking about? So if hepatitis occurs in a pregnant lady, you have to look out for what actually you know. Hepatitis to pata lag jayega. You have to find out, does she have a high infectivity wala hepatitis or not? How do I know out infectivity? HBE. If the mother has high infectivity wala hepatitis, means if HBe antigen is positive, then the chance of transmission is very high, 90%. But if she has in that phase had an antibody, HBe antibody is present, then at that stage the risk of transmission is only a 10 to 15%. So simple, if infectivity antigen is there, more risk of transmission. If the antibody has developed, less risk of transmission. Either ways, whenever a neonate is born to a mother with hepatitis B, what do? On one arm you put vaccine, on one arm you put immunoglobulin. So on one arm you're going to put immunoglobulin, on other arm you put hepatitis B vaccine. I think everyone as a healthcare professional knows the hepatitis B vaccine ka dosage is or scheduling is 0, 1 month, 6 months. So 0 dose, 1 month and 6 months. So now that when you're talking about the vaccine, I think we all know that hepatitis B vaccine ka schedule to we have done. It is 0, 1 month, 6 month. This is prepared in a yeast. If you still want to know which yeast, Saccharomyces cerevisiae. This is prepared in Saccharomyces cerevisiae wala fungus or yeast, and it is a recombinant killed vaccine 016. Every time you have gone in for this, you have taken the 016 wala dosage. However, what I'm also going to tell you, what is important, you are a healthcare worker and needle stick injury is something you should be knowing even before taking admission into MBBS. Unfortunately, we don't even know about it after clearing MBBS. But that is safety. Our safety comes first. So first and foremost, all of us have been vaccinated in our childhood. So ideally, what is the antibody titer that we should be having? Anyone who has already been vaccinated should have an antibody titer of anti-HBs more than 10 international units per ml. On that note, let's consider someone who's had a needle stick injury, and I've got you the latest guidelines because not just everything is not about MCQs or exams. Some things are about self precautions, right? So what happens following a needle stick injury? You need to find out what is your status and what is that patient's, just a needle prick hua hai, what is his status. So you need to know the status of your source, whosoever was that needle wala person, and you need to know healthcare worker. You need to know your own status. So for example, if you are by chance, if you are unvaccinated, although I don't come across such people, but you could have people elsewhere also, not only hospital workers don't get needle pricks. There are so many people who have IV drug abusers and otherwise also, they can get a needle prick and they come to you and say that we are unvaccinated. So kya karoge? And they then, okay, their status to you know, they are not vaccinated. Then you will ask me, needle prick kiska hua? Do you know that that person is HBV positive or negative or not known? So there are three possibilities. If the person is definitely HBsAg positive and your healthcare worker is also unvaccinated, मतलब उसे hepatitis है और इसके पास vaccine भी नहीं था, you will have to do everything. You will have to give immunoglobulin also, plus you will have to do 016 का vaccine also. You will have to do everything in this person undoubtedly. If the person is proven hepatitis B negative, then you are just gonna do 016. Just start the vaccine of this person because this person was not vaccinated, so uska vaccine shuru kar do. Even if the source is not known, you still go in for 016, and that is, you start with vaccine. The basic concept is that this person is not vaccinated. So in all the cases, your primary concern is pehle to give him a vaccine. But if your source was known, you have to take extra precaution. You also give him immunoglobulin. Sorted? Okay. Coming to the next, which is most commonly what you guys will see. I mean, God forbid you may never have a needle prick injury, but it's such a common thing that everyone ends up having one in their lifetime. I also had one during my first year residency, MD. Okay, so next is, if you are vaccinated, which most of us are, you first need to know whether you are a responder or a non-responder. How will you find out? Based on your antibody titer. If you are vaccinated, if your antibody titer is more than 10, you have responded. If it is less than 10 or in 0, like in my case I'm sharing with you, when I had a needle prick injury, my antibodies came down to be less than 10. I don't know why, although I know I was vaccinated in my childhood, but there are 4% of people who don't make antibodies. That is when I sat and read about it. So I came under the non-responder category. So remember, either you can be vaccinated and a responder or vaccinated and a non-responder. So what are you going to do? See, if you are vaccinated, very good. And if you are a responder also, very, very good. Then they say that ideally you don't have to do anything. Then they say that ideally you don't have to do anything. But if you are vaccinated, like I'm sharing my case with you, I was vaccinated, but I did not respond. So now we had to look at the patient over here, look at the source of it. So if you are vaccinated, तो नाम का vaccine है, response तो नहीं है ना. So it is almost equivalent to an unvaccinated person. Injection तो लगा, but your body did not respond. So what are you going to do? Ma'am, you'll take full everything. You will take immunoglobulin also, and you will take 016 vaccine also, and that is what I did. Because unfortunately, when I got a needle prick injury, I was vaccinated and I was at least happy that chalo, I'm vaccinated. But what was the bad news was that when I got my blood test done, I turned out to be a non-responder, that is less than 10 international unit scale. And what was even worse was that then I got to know later on that my patient was also hepatitis B positive. So I had to go in for this entire protocol. I got an immunoglobulin, same day I got the first dose of the vaccine, and then I continued this, and thankfully with God's grace, nothing happened. Okay, what if your source is negative? So you are vaccinated, na? ठीक है. Don't do anything, and if the source is unknown, don't do anything. Although here they say there are a lot of things which are getting a little, changed. They say that people who want to be on the precautionary side, they can take immunoglobulins, even if the source is not known. These two categories, people are a little, and even I would have been a little scared about it. That I am a non-responder anyway, so why take a risk and why not take the precautionary dose? So that depends from hospital to hospital, but this is the basic thing. So simple. If you are unvaccinated and you get a needle prick injury, so you should know if you are unvaccinated, ek to pehle vaccine lagwa lo abhi se. But if you are unvaccinated, anything anytime happens, vaccine you will always have to take 016. Additionally, you will take immunoglobulin if your source turns out to be positive. If you are vaccinated and a responder, you are the safest person on this planet. Again, some people still take it up for precautionary measures. Okay, now finally, there are going to be some variations. Ye sab to ho gaya. But what do you call as a person who's a carrier? Who is a carrier? Because I told you, hepatitis B was the one that had a 30% carrier state. Okay, when the surface antigen is positive beyond 6 months, that is the definition of a carrier. Surface antigen positive beyond 6 months is a carrier. So simple carrier or super carrier. Simple carrier, super carrier ka definition is same. Surface antigen beyond 6 months is carrier. What is the difference between simple versus super? So imagine super will be super duper infective. Super duper infective means HBe antigen is also positive. And the DNA polymerase is also there. The liver enzymes are also increased. That is why he's super duper. E bhi hai, DNA polymerase bhi hai, enzymes are also elevated. Simple is just simple. Keep life simple. Simple definition. HBs is positive beyond 6 months. That's about it. Not HBe, and DNA polymerase levels are also very low. Simple, तो simple वाले में सिर्फ simple HBs रखना. Super duper में HBe also, DNA P also, liver enzymes, everything goes up. Now moving forward and talking about some variants. So right now I was telling you there is a surface antigen, there is an HBe antigen, but now viruses are mutating. So what if there is someone who is said to be an escape mutant? So now let's go on to discuss a few mutations, because we all know that viruses are much prone to mutations. So let's take the first one that we have, and these are going to be the escape mutants. What are escape mutants? The ones which don't have a surface antigen. So what is the problem with them? The problem is that all of us have one point of time been vaccinated with hepatitis B. This means all of us have anti-HBs antibodies in our system. And the reason that we've got them in our system is that if a hepatitis virus tries to enter us, those antibodies are able to neutralize it. But if this hepatitis B virus enters, which doesn't have a surface antigen, it is a hepatitis, it is going to cause infection, it's just trying to be an escape, it's not showing that antigen only. So will this be able to neutralize it? No. Remember, this will not be able to neutralize the escape mutant. Our protective antibodies will not be able to neutralize the escape mutant. That is what is important. This is one thing. The second mutant that we have is a pre-core mutant. It's telling you pre-core was HBe antigen. If the HBe antigen is absent, that becomes a pre-core mutant. And please note, in such patients, infection to kaise pata lagega high infectivity is there or not? You will measure the DNA copies. DNA copies more than 1000 is going to be indicative of infection present. That marks the end for all of you for hepatitis B. And out of this, just one word that I want to tell you from point of view of healthcare workers, that nowadays a lot of healthcare workers are actually showing you these kind of escape mutants, because staying in the hospital and getting exposed to so many things is resulting in mutations. So escape mutants is becoming common in hospital or healthcare workers. There is